Okay, so hi, my name is Mark, M-A-R-K, Kendrick, K-E-N-D-R-I-C-K, Priyaneza, F-R-I-A-N-E-Z-A. So today I'm gonna be doing my first lab assignment. Before I started, I'm gonna be showing you guys the environment that I'm gonna be working on. Okay, so now I'm gonna introduce you to my patient. She is my sister. Her name is Irish. Okay, so now before I go to check my patient, I'm gonna be sanitizing the equipment that I'm gonna be using, and also I'm gonna show you guys the hand washing. Okay, so now I'm all set. I'm gonna go and check my patients now.
Come in.
So hi, my name is Mark. I'm gonna be your student nurse for today. Before we started, do you need to go to the washroom to empty your bladder?
No, I'm okay.
No? Okay, so do you feel comfortable and safe in this room?
Yeah.
Okay, so now I'm gonna provide patients privacy. So before we started, I'm gonna ask you a few questions. Okay, so the first question is, when did this all started, the morning headache and the watery eye?
It started 2 days ago.
2 days ago. Okay, so do you have any allergies at all?
No.
No? And how old are you?
18.
18. And okay, so do you sleep late at night actually?
No.
No? Do you have past history of this sickness?
No, I don't.
No? Okay, so the patient's age is 18. She has, her skin is appropriate to her background, and she is not showing any inappropriate smell as well. Okay, so her height is 5'2". She has a good posture. She has a good straight posture. Her body build is appropriate to her age as well, and she is well groomed, and she doesn't show any physical deformities as well. Okay, so now I'm gonna check her behavior. So based on her questions and answering in the based on her answers in the questions earlier, she seems relaxed, and her voice is clear. She maintains eye contact when answering questions, and she is well groomed as well. So now I'm gonna be checking her mobility. So can you please stand up for me? Okay, so can you please walk from here and then go back here? So do you feel any pain at all?
No.
No? Can you lift your feet up? How about the other side? Do you feel any pain? No? Okay, so you can sit now. Okay, so the patient is ambulatory. She doesn't feel any pain or tenderness while walking, and she can do range of motion without any difficulties at all. She doesn't show any signs of distress as well, and her breathing looks normal. Okay, so now I'm gonna be checking her level of consciousness. Okay, so I'm gonna ask you some questions. Okay, so the first question is, do you know where you are right now?
I'm in the hospital.
Okay. Do you know what is your name?
Irish Dan Frianeza.
And can you tell me what time is it right now?
It's 8 a.m.
8 a.m. Okay. So as you can see, her level of conscious is alert. She seems relaxed, and she is also alert and awake, and she doesn't show any signs of sleepy. Okay, so now I'm gonna go and check her head. So as I can see, her head is normocephalic, no deformities, no lumps, no lesions, no swelling, and okay, so now I'm gonna palpate her head. Okay, so do you feel any pain?
No.
No? Okay, so no pain, no tenderness, no swelling, no lumps, no visible masses. Her hair distribution is well distributed, and the hair is also appropriate to her background. She has no manifestation or foreign bodies as well. and no pigmentations as well. Okay, so now I'm gonna check her face. So as I can see, okay, so her face is symmetrical. Her nose is midline. No pigmentations, no loss, no edema, no swelling, no lumps, no lesions. Her her skin color of her face is appropriate to her body. Um, as well, her texture is smooth, and the temperature is as well as normal and warm. Okay, so now I'm gonna be checking her cranial nerve 7, which is her facial. So now, can you please smile for me? Show me your teeth. Can you frown for me? Can you puff your cheeks? Can you please lift your eyebrows? Can you please close your eyes? Okay, so the patient is, her cranial nerve 7 is intact. So now I'm gonna be checking her eyes. Okay, so based on her eyes is symmetrical. Her eyebrows is equally symmetrical to each other. Her eyebrows, her eyelids, and her eyelashes is symmetrical. Doesn't show any crusting at all. No lesions, no discharge. Okay, so now I'm gonna be checking her sclera, and as well, I forgot to tell you, doesn't show any ptosis, no lid lag, and no exophthalmos. Okay, so I'm gonna be checking her sclera and her sclera and her her sclera and yeah. Okay, so based on her sclera and her sclera is it's glossy, it's moist, it's pink, and the blood vessels is intact as well. Okay, so it's sclera and conjunctiva. I forgot. Yeah. So now I'm gonna be checking her accommodation about Perla, which is the cranial nerve 3 for oculomotor. Okay, so Perla means pupil equal round, reacting to light, and accommodation. Okay, so based on her eyes, okay, so the eye size is 3 centimeter, and so the eyes is 3 centimeter. The pupil's eyes is 3 centimeter. It is round and it's symmetrical to both each other, and then it's reacting to light as well. So now I'm gonna be checking her accommodation. So can you please follow this pen? Okay. So her eyes is accommodated. So that's all for today, and thank you so much.